Knee injuries such as ligament sprains to the MCL or the ACL are common in adolescents, especially those participating in pivoting or contact sports. Depending on the severity of the sprain, it can take as little as 4 to 12 weeks of conservative management. For more severe ACL injuries that require surgery, it can be a longer journey of up to 2 years. If you're having your ACL reconstructed, the graft usually comes from one of your tendons, typically either the hamstrings, the patellar, or the quadriceps. Tendons have a different makeup than ligaments, so the graft has to go through a process called ligamentization. This is where the graft slowly becomes more and more like your native or original anterior cruciate ligament. Ligamentization is unpredictable and can take anywhere from 9 months to 2 years. The graft is actually often at its weakest from about 6 to 8 weeks, and this is when people tend to feel like they're improving and getting stronger. So this is a period where you should be a little bit more careful to make sure that you don't injure your graft at this stage. The exercises that we're showing in the secondary injury prevention videos are for people who are more at that 4 to 6 month post-surgery range. This is why returning to sport after surgery is only recommended after about 1 year of rehabilitation. It's beneficial to see a physiotherapist throughout the entire first year. Your appointments may decrease in frequency after about 3 months, as long as things are progressing as we'd expect, and you might only see your physiotherapist every 4 to 6 weeks, for example. Returning to plyometrics like jumping and hopping is an important part of getting back into your sports and making a full recovery. Your physiotherapist will assess your readiness for these types of exercises and help you progress through different levels of difficulty. Your progression will depend on several factors, such as your adherence to your strength training at the beginning of your recovery, if you have any complications or other injuries at the same time. For other knee ligament injuries, if you don't need surgery, the timeline will probably be accelerated, but your exercises will be quite similar. Although our secondary injury prevention exercises in this video series are talking more about warm-up exercises, keep in mind that strength training is an important part of injury prevention. You can see on our website some examples of strength exercises. Eventually, the rehab mindset should shift to one of just simply living a generally healthy, active lifestyle, following the ACSM guidelines of strength training twice a week for at least 20 to 30 minutes.